Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and I am thrilled to introduce you today to the one plant on earth that is known to literally prevent, reverse, and often cure venous conditions, blood vessels, veins, arteries, and the issues that come with them. Do you know anybody who has spider veins, varicose veins, discolored legs from the knee down, ankles, feet that are red or purple or dark? Those are all signs of venous insufficiency. Blood flows going down the legs, but it ain't coming back up. Anyway, I'm very excited to actually educate you on some of the research we put together about one of the most exciting things I've learned about in the last couple of years to help people with cardiovascular conditions, but particularly those that involve blood moving from the heart to your organs and back to the heart. And this is what that show is all about. So I'm ready to dive in. I hope you're excited about this. I hope you're doing well. And here we go. All right, I'm going to start screen sharing here, our presentation. I hope you're as excited as I am. If you know anybody who's suffering with high blood pressure, low blood pressure, blood clotting, if they've got issues with spider veins, varicose veins. All right, one plant known to cure all vein diseases, such as spider and varicose veins, by yours truly, Dr. Ardis. Scan the QR code to get on our email list so that you can be notified with any type of new production we're doing, documentaries, books, publications, presentations, speaking engagements, book signings, or even our next podcast. So you can be up to breast on what it is I'm investigating, what I'm researching, so that you know the truth of what's available in natural medicine. All right. Cleveland Clinic has defined venous disease, venous, venous disease, as such. It is a condition that affects the veins in your body. Veins are flexible, hollow tubes that are a part of the circulatory system that moves blood through your body. Veins bring oxygen-poor blood back to the heart, which pumps your blood. Arteries are different. They carry oxygen-rich blood away from your heart. Veins have flaps or valves inside that open when your muscles contract. This allows blood to move through your veins. When your muscles relax, those valves close, keeping blood flowing only in one direction in a vein. If venous disease damages the valves inside your veins, the valves may not close completely, and this lets blood leak backwards or flow in both directions. All right, so just so you're now acclimated, in case you don't have a clear definition of the difference between arteries and veins, they are not the same. Arteries go from the heart and deliver oxygenated blood to the rest of the body. And as you look at the image on the left for arteries, you will see it's just a tube where blood just flows in one direction. Now look at the blue vein and you will see the arrow of blood and the way it moves, but you'll see there's little check valves that only allow blood to go up, and then those valves will close to keep the blood there. Veins are designed to bring the blood that has had oxygen in it that now has been delivered to your muscles and all your other organs and cells. Veins are designed to carry blood that no longer has oxygen back to the heart to get more oxygen. Now, picture your legs, picture that vein on the image on the screen, the veins that go from your toes and feet up to your heart. If there's something wrong with those valves and they don't close completely, like you see in the top of the image of the vein, you see two valves. One is open at the bottom, the one is closed at the top. If there is any reason why that tube called a vein actually got bigger, that valve could not close and the blood goes backwards. This is what you're seeing when you have someone who has spider veins, varicose veins, or discolored red, purple, black, darkened areas of the skin in their feet or calves, particularly in diabetes and other issues. That's what causes the discoloration. Blood is pooling and staying down in that limb, and it's not coming back up because the veins either expanded too far, it's not strong enough to stay a tube tight, or there's something wrong with the valves themselves inside the veins. Arteries do not have veins. All right. Here's our Cleveland Clinic has now also defined what are the various types of venous diseases. So listen, if anybody you know or love has this conditions, any of these, you need to share this podcast with them, this presentation. Also, this entire PowerPoint presentation, every slide is also at the Patient's Resources tab on the drardisshow.com. It will be in a PDF form. You can just download it for free. And it's just the PowerPoint presentations with all the research highlighted and the recommendations in the research studies to cure this condition. All right, so types of venous diseases. Number one is blood clots. And I'm going to read these to you. This can happen in your legs, arms, veins of your internal organs, kidneys, spleen, intestines, liver, pelvic organs. It can happen in your brain. That's called a cerebral vein thrombosis. It can happen in your kidneys, a blood clot. That's called a renal kidney vein thrombosis. Thrombosis means clot. Or in your lungs. And that kind of blood clot's called a pulmonary embolism. And then you have what are called deep vein thrombosis, is another type of venous disease. And we're going to be discussing the one plant that cures all of these. Deep vein thrombosis, or DVT for short. This is a blood clot that occurs in a deep vein in your arms and in your legs. All right. These are not of themselves life-threatening, but if it dislodges and makes its way to your heart, it can cause a heart attack and you could die or have a stroke. The next one they list is superficial thrombophlebitis. It's a lot of words that you could not spell in a Scrabble game. This is a blood clot that develops in a vein close to the surface of your skin. These types of blood clots don't usually travel to your lungs unless they move from your superficial system into your deep vein system. Typically, however, they do cause pain. Here's the last of the list of venous diseases per the Cleveland Clinic, chronic venous insufficiency. You will see this abbreviated even in my presentation in some research studies as CVI, chronic vein insufficiency. This condition causes pooling of the blood, chronic leg swelling, increased pressure, increased pigmentation or discoloration of your skin, and even leg ulcers known as venous stasis ulcers. And I'm going to show you what those look like in a second. Another type of venous disease, which most women in America are not happy about and sometimes get while they're pregnant or as they get older or gain weight, varicose and spider veins. These are abnormal, dilated blood vessels that happen because of weakening in your blood vessel wall. I talked about that earlier when I was showing you the veins. If it expands and gets bigger, those valves can't close. Venous ulcers. Ulcers are wounds or open sores that won't heal or keep returning. Venous stasis ulcers most commonly occur below your knee or in the inner part of your leg, just above your ankle. Arterial venous fistulas. These are arteries and veins that connect to each other directly with nothing in between, and this is very abnormal. Well, that is a congenital deformity, something that developed in the womb most likely. All right, so those are your various types. All right, now, if you don't think this applies to you, this discussion, look at this stat. Cleveland Clinic says, how common is venous disease? Venous disease affects more than 30 million people in the United States. Just so you know, that's 1 out of every 10 people in America. I'm sure you know somebody that has one of these. All right, next statement. Researchers predict even more people will have it in the future. All right, well, if you don't know anybody that has it now, and they do in the future, you need to make sure they know about what I'm teaching right now. And did you know that roughly 33% of all adults in America have varicose veins? That's 1 in every 3 need to watch this podcast and learn what this mysterious, amazing, miraculous plant is. What are some symptoms people have when they have a venous disease? Cleveland Clinic says pain, cramping, or discomfort, redness or warmth at the skin, heaviness, itching or burning feeling, swelling, and then obviously bulging veins like in spider and varicose veins. I'm going to show you what some of those look like. You ready? Here are the various stages, they call it, of chronic venous disease. Stage 1, spider veins. Stage 2, varicose veins. Stage 3, swelling of the whole lower limb. Stage 4, the skin color changes. And then change 5 or 6, venous ulcers. And you can see the wound down there. Many diabetics and those overweight will often have those because the blood is pooling, and unoxygenated blood, when it's stagnant, can become toxic to the skin. And guess what your body's going to do? It has to get it out. It will open a wound, and it will continually seep until you fix this problem. What are some other images that you're probably familiar with venous diseases? What does it look like? It looks like that. It also looks like this. It also looks like this. Massive discoloration from the calf down. It also can look like this. Slight red pigmentation from the calf or the knee all the way down to the feet, with swollen feet and toes. It can also look like this. You'll see the open ulcers there. There's two images there. You'll see the spider veins and the varicose veins. The plant we're going to talk about today is called butcher's broom, a shrub with some amazing, surprising benefits, says Healthline magazine. And I showed you a picture of what butcher's broom, the plant, looks like. It looks like a beautiful Christmas plant with bright red berries. All right. On Healthline magazine, they have a section I want to highlight, and then I'm going to dive into some research studies for you here in a second. This is just top level summaries from a very reputable medical online journal. Butcher's broom may treat poor blood circulation. And that's what we're talking about today. Read the red highlighted sentences with me. Several compounds in butcher's broom help veins contract, shrinking that tube, allowing blood to return to the heart. Remember, I was describing it to you. When that tube closes, the valves can now shut completely and the blood cannot go pool down with gravity down to your feet or in your hands. In fact, research indicates that butcher's broom significantly reduces tension and swelling around the lower legs and ankles in adults with chronic venous insufficiency. I mentioned earlier, you will see the abbreviation CVI. If you guys know anybody that have these symptoms on the screen, these images, butcher's broom has been shown. Look at the swelling on the legs on the left. Most people with venous insufficiency will have swollen toes, ankles, feet. You don't even see their ankles. You've heard the term cankles. They just start to swell and balloon up. I just want you to know, I'm going to show you research today that's going to blow your mind on how effective butcher's broom is at reversing that edema and swelling in the lower legs. And who wants swelling in their lower legs? An analysis of 20 studies found that a supplement that contained butcher's broom significantly reduced pain, cramps, and swelling in adults with chronic venous insufficiency. Swelling in adults was reversed. You see that in the statement? Significant reduction in pain also. I just want you guys to be aware, it's mentioning it's in a supplement. 20 different studies have confirmed it's effective. Butcher's broom is already in my supplement at the Dr. Ardis Show. It's actually called Cardio Flow. And it's actually one of the highest percentages of weight volume in that product. It's called Cardio Flow for a reason, people. We developed that during COVID-19 with the vaccine injuries, with the COVID side effects on the blood clotting, heart attacks, strokes, you name it. When I formulated that product, it had to have this ingredient in it because I could not wait to watch you have the blessings and the benefits of this incredible plant. And by the time I'm done here in a few minutes, you're going to see it's pretty powerful. Now, what's on the screen is a drug called pentoxifylline. What is this for? This is a prescription drug cardiologists will prescribe, and you can read the statement below. What's it for? This is on drugs.com. Pentoxifylline causes changes in your blood that help improve blood flow. So this is a blood flow product. They're trying to say this is going to help you with venous insufficiency. Brand names include Trental, and Pentoxil. Pentoxifylline, they write at the bottom, look at that, on drugs.com, is not a cure for this condition. Butcher's broom can be, but this drug, cardiologists often prescribe for venous insufficiency issues like the pictures I showed. They tell you, the medical profession knows that drug is not a cure for this condition. These are some of the serious side effects of that drug that your cardiologist may prescribe or your general practitioner may prescribe if you have varicose veins, spider veins, ulcers, or swollen limbs. It has serious side effects that include chest pain, pounding heartbeats, or fluttering in your chest. Who wants that? Red or pink urine. That means you're bleeding from your kidneys or your bladder. A lightheaded feeling like you might pass out. I don't think that's a good idea. Signs of stomach bleeding, including bloody or tarry stools, cough up blood or vomit that looks like coffee grounds. Oh, sign me up for pentoxifylline. Sounds like a wonderful drug. Common side effects include dizziness, headache, nausea, vomiting, diarrhea, gas, bloating, or upset stomach. Guess what doesn't do that? Butcher's broom extract, the plant. Now, this is midodrine, and if I'm mispronouncing these, that's because I'm not a medical doctor that was brainwashed to just sell you drugs. Midodrine. Brand names are Proamatine and Orvatine. What is midodrine? Midodrine is used to treat low blood pressure or hypotension that causes severe dizziness or a lightheaded feeling like you might pass out. That's this drug. That's also to help with blood flow. All right, what are some of its more common side effects? Blurred vision, cardiac awareness. Something's wrong with my heart, I can tell. That's a side effect. Headaches, pounding in your ears. Look at this. Rare side effects, though. A side effect. Fainting, increased dizziness, and slow pulse. Also, burning, itching, prickling of the scalp, chills, goosebumps, urinary retention issues, urgency. Less common side effects include anxiety, confusion, dry mouth, flushing, headache, skin rash. Do you know what doesn't have any of those side effects? Butcher's broom. Here's some more side effects that they list: backache, canker sores, dizziness, drowsiness, dry skin, leg cramps, stomach problems such as gas, heartburn, or nausea, trouble seeing. I don't know about you, but I like my vision. Trouble with sleeping. I also like resting, and weakness. I don't know anybody that says, sign me up for being more weak than I already am. Butcher's broom, continued in the Healthline article, may reduce your risk of hemorrhoids. Now, in case you didn't know this, hemorrhoids are blood vessels. Read the highlighted sentence. Butcher's broom is used in alternative medicine to treat hemorrhoids and other vascular conditions as it appears to reduce swelling and helps veins contract. They're falling out of your rear end because they're not contracted anymore. 69% of people taking a supplement containing Butcher's broom rated it an effective treatment for hemorrhoids that reduced pain, swelling, and other symptoms. How exciting. Well, what are the drugs that your medical doctor will prescribe for hemorrhoids? The first one on the list, the most common brand, is Analpram. Analpram. Get it? Hemorrhoids, Analpram. All right, let's look at its serious side effects of Analpram. Signs of an allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin. That sounds awesome. With or without fever. Okay. Wheezing, tightness in the chest or throat, trouble breathing, swallowing, or talking. I don't know about you, but I like talking. I guess if I took this and wiped it on my rear end for hemorrhoids, it's going to affect my talking. I think that's a problem. Unusual hoarseness or swelling of the mouth, face, lips, tongues, or throat. Well, I guess if you like Botox and you want to swell up parts of your face with Botox, you can just do it with Analpram. Put it on your lips. People getting all those plumpers in your lips and see your lips swell up with Analpram. You don't need Botox. You need Analpram. All right, now look at the next list of serious side effects of Analpram for hemorrhoids. Weight gain. Sign me up. Did you know weight gain is actually a complication to cause more hemorrhoids? All right, I don't think adding weight is a good idea. Change in your eyesight. Okay, people, look at this. Look at this side effect. Change in your eyesight. Okay, you can either see or not see. So if your eyesight's changing, it's not for the better. Do you want worse eyesight? You should wipe this cream on your anus if you don't like seeing as clearly as you do. Very bad headache, very bad skin irritations, very bad bleeding from your rectum or rectal pain. That doesn't sound any better than the hemorrhoid you already got. And then look at the bottom. Signs of high blood sugar like confusion, feeling sleepy, more thirst, more hungry, passing urine more often, flushing, fast breathing, or breath that smells like fruit. It's called diabetes, by the way. All right, these are all side effects of Analpram, the most common hemorrhoid prescribed treatment cream by medical doctors. Here's some other symptoms. It causes skin irritation, dry skin, burning, itching, headache, upset stomach, or throwing up. Well, I'm not sure throwing up is better than having hemorrhoids. And even if you were throwing up, you know, your whole stomach contracts. It's going to make your hemorrhoids worse. I think this sounds horrible. Here's the second most common prescribed drug for hemorrhoids by your medical doctor, Promosone. Let's look at its serious side effects. Look at all the signs of allergic reaction, just like the other one. Signs of a weak adrenal gland, like a very bad upset stomach or throwing up, very bad dizziness or passing out, muscle weakness, feeling very tired, mood changes, not hungry, or weight loss. Or you might develop signs of Cushing's disease when you wipe this Promosone on your booty. Signs of Cushing's disease like weight gain in the upper back or belly, a moon face, very bad headache or slow healing. In fact, I think JFK actually had Cushing syndrome. In fact, I think he did. Signs of high blood pressure like confusion, feeling sleepy, more thirsty, more hungry, passing urine, flushing, smelling like fruit, your breath. Irritation where the drug is used. Okay, well, there's already irritation when there's a hemorrhoid. Why would you want to add irritation? And then very bad bleeding from your rectum or rectal pain. Is it bad enough you can't sit and you have to sit on a donut pillow? Is it really better to have blood coming out of your butt? I don't think so. That's your two drug options, the top two prescription drugs by your medical doctor. Butcher's broom, baby. All right. I need to show you this because I'm about to take you through research studies, and they don't call the plant most often in science papers. They don't call it Butcher's broom. They call it by its scientific name, and I'm highlighting it on the screen. Ruscus aculatus. Aculatus. So you're going to see ruscus or aculeatus, known as butcher's broom. I just wanted you guys to see that when you see ruscus or R. aculatus, that is butcher's broom. But I didn't want to show you these 3 or 4 research studies and you get confused going, wait, I thought he was talking about butcher's broom. I am talking about butcher's broom. This research paper is titled The Contribution of Muscular Receptors, Muscle Cell Receptors called muscarinic muscle receptors. Think about all muscles in your body, skeletal muscle, heart. Contribution of muscle receptors in the lab and in human beings, effects of ruscus extract. What is ruscus? It's butcher's broom. All right, so here we go. The effects on your average artery and vein diameters, the width of the tubes of your arteries and your veins. Ruscus extract, butcher's broom, elicited statistically significant constriction of the veins called venules. It literally took that tube that was wider and it actually causes it to constrict, get smaller so the valves can close and shut together and hold the blood up above it. In animals treated with different concentrations of butcher's broom, topical applications of atropine elicited arterial constriction, but no significant changes on elicited venular constriction could be observed. They took this butcher's broom extract and a drug called atropine in this research study. I just want you to know, when they did that, the atropine made the arteries constrict. Butcher's broom made it open back up, and you want arteries opened up bigger to deliver oxygen. It's veins you need to shrink or constrict or close, and they're going to demonstrate that in this research study. So here you go. You're going to see at the top, you see mean arterial diameter. That means the average artery diameter, the distance from one part of that tube to the other in an artery. The placebo group, you'll see what their measurement of the width of their arteries were, and then they gave them ruscus extract at 50 milligrams per every 2.2 pounds of body weight every day. And those animals' arteries started to get bigger at 50 milligrams. The group they gave 150 milligrams of butcher's broom to every day, it actually got even bigger. At 450 milligrams, it stayed the same as the 150 milligram group. So there's really a cap of what the body will use at this 150 milligrams. If you look at the next one, the next chart, bar graph, it says mean venular diameter. That means the average vein diameter. And you need everybody with varicose veins, spider veins, or the images I showed a minute ago. If you have venous disease of any kind, your veins are too big. They need to be shrunk down or constricted. And you're going to see here, the placebo group, you see the size of their veins at about 40 nanometers. Then look what happens when they gave them 50 milligrams of butcher's broom. It went way down to like 25 nanometers. The width of those veins, it shrunk a lot. Oh my goodness, by like 20%. Then you look at the 150 milligram group. It actually just looks identical or a little bit lower, shrunk a little bit more. But the 450 milligram group, where you got more than enough, it went up just slightly in its diameter. So that 150 milligrams is like the sweet spot per day for this artery diameter and the vein diameters to improve. In this study, they state butcher's broom, called ruscus extract, resulted in a statistically significant dose-dependent. The more we gave from 50 milligrams to 150 milligrams, there was a reduction in the macromolecular permeability increase induced by topical application of histamine compared with placebo. Did you know that when histamine is released in your body as an allergy reaction, that it actually increases the width of your arteries and the width between the cells of your arteries and your blood vessels to allow blood to leak out into your body? That's what they're talking about here. And this is what they found when they gave these people butcher's broom and histamine at a dose dependent. It actually would seal up the arteries so that blood couldn't leak out as an allergy reaction to excess histamine reactions. And here they show you the placebo with the histamine. You see how high it is. And then they give butcher's broom at 50 milligrams, 150 milligrams, and then 450 milligrams. If you know people are having massive amounts of hemorrhaging, bleeding out, you ever seen people with Coumadin spots all over their arms, blotches, bruises all over their body when they're on blood thinners? This is what we're talking about. Butcher's broom, every dose, as you increased it, the actual arteries became tighter and there was less and less leaking of the blood. out of your arteries and blood vessels. The researchers say the aim of this study was to investigate the activity of butcher's broom on muscle receptors and the potential contribution of its activity to vein tonicity, making the vein stronger and more tight, and the anti-inflammatory properties of butcher's broom. How does it reduce pain and inflammation? In the second part of the study, they said we used in a body of a mammal this model to further evaluate the potential impact of butcher's broom as a muscle property on its effects on microcirculation. So all of your veins and arteries are made of muscles, and they're looking to see each of those muscle fibers that are the blood vessels. How does butcher's broom impact the muscle integrity of the little bitty blood vessels in your skin and organs called capillaries? These are the little bitty micro blood vessels. In this present study, they gave orally butcher's broom, and it induced vein constriction in the HCP, the animal model microcirculation blood vessels. So when they gave them butcher's broom, all of their blood vessels got constricted. They actually got tighter and smaller, which means it was reversing their vein disorders. The lack of the lack of artery constriction is beneficial. The butcher's broom did not constrict arteries. It actually opens them up. And they're telling you in here, the fact that it opens up arteries to deliver more oxygen-rich blood, and it constricts veins, which are bringing no oxygen blood back to the heart. The lack of artery constriction by butcher's broom is beneficial to the capillary circulation, all the blood vessels in your skin and in your organs, which is able to keep its blood supply constant. So this butcher's broom plant, the miraculous side is it opens up one particular artery and makes more oxygen-rich blood go to the brain and the rest of the body to work better. And then it constricts the veins to help you bring blood that needs oxygen back to the heart. An increase in the overall size and permeability, the ability of blood to move in and out of a blood vessel due to widened gaps between cells. They tell you, I'll just read it straight. An increase in macromolecular permeability, the ability of blood to leak out of your blood vessels due to widened gaps between the blood cells and the actual structure of the tube of your veins and arteries, between contracted skin cells of the postcapillary veins, is an important event in inflammatory reactions and edema formation. The only way your ankles and toes swell is because blood is getting out of the blood vessels and into your tissues. It's leaking out. Our results have shown that butcher's broom extract protects against both histamine and this other induced leakage in the models of these animals, and this is in agreement with previous findings. These animals stopped pouring out blood into their limbs, causing edema and swelling with butcher's broom. It tightens up the junction between the cells and their arteries and veins, and it helps the blood stay in those arteries and in the little bitty blood vessels so you don't get swelling and edema. And they're just stating, we've already seen this reported by other researchers. Now, this is incredible. And I know these are some big terms that a lot of people don't know, so just bear with me. I promise I'm going to make it make sense. Venous vein blood stasis. Stasis means it ain't moving. It's stationary. So vein blood that is stagnant and just sitting in the leg or in the foot, like I showed you those images of purple and red legs. Venous blood stasis observed in patients with chronic venous disease limits the oxygen supply to the veins in our skin cells, which form a barrier between the blood and the vascular tissue of your skin or your organs. Hypoxia means low oxygen, leads to endothelial cell inside the blood vessels activation and the release of chemotactic and mitogenic factors. Our results in this animal model shows that butcher's broom extract reduces macro large molecule permeability. This reads, our results show that butcher's broom reduces the leaking of blood out of your blood vessels to create edema in your legs and in your arms and in your feet. They also state our results strongly suggest that its action can improve the endothelial, the inside lining of your blood vessels dysfunction that is observed in chronic venous disease. This is miraculous for everybody out there that has any venous deficiency issues. And there are millions, 30 millions of them. And 33% of all adults have varicose veins. 33% of you all have this. Venous blood stasis. I just need to show you what this is. This is venous blood stasis. That is blood that should be going up to the heart, but instead it's staying down with gravity, leaking out of your blood vessels into your feet and into your legs. The conclusion of this study was, our results have shown for the first time that butcher's broom extract has binding affinity to muscle receptors in the blood vessels. And the activity of butcher's broom extract, called ruscus, at these muscle receptors may contribute to its blood protective and anti-inflammatory therapeutic effects. Now, in this research study, this is titled "The Effects of Ruscus Extract Butcher's Broom on the Internal Diameter of Arteries and Veins of a Hamster's Cheek Pouch." Now, they study hamsters, mice, rats. They tell you, remember, we've mentioned this a million times. The reason why we study tissues, drugs, vaccines, and animals first, especially these little animals, mice, rats, rabbits, and hamsters all have the same genes human beings do, and they publish 100% of the time if it's going to happen in a hamster, happen in a mouse, happen in a rat, it's going to happen in a human. So I just want to show you some of the highlights of this study. You are not a hamster, but I want you to see, again, that this helps to dilate or open up arteries to deliver more oxygen to your tissues. Think brain fog, weakness, gait issues. You need more oxygen to your body. And then it shrinks the veins in the body to reverse venous disease. So in isolated skin veins, the butcher's broom extract causes contractions due to the activation of several things. I don't even need to read those, what those are. And through a direct action on the venous veins smooth muscle. So they're just telling you butcher's broom acts on artery muscle walls and on vein muscle walls. In this present study, we used the hamster cheek pouch preparation and investigated the effects of butcher's broom on the diameter of arteries, since those vessels are the preferential target for local control influences and of functional importance for final blood flow. Arteries pump the most blood through your body. The hamster cheek pouch has both skeletal muscle and cutaneous skin microcirculatory beds, so capillaries or little bitty blood vessels in the skin and in the mouth. And in the present study, the experiments were performed in the cutaneous part, the skin part of the pouch, of the cheek of the hamster, to facilitate the comparison with data they have already read in research literature. This part of the pouch is highly vascular, just like the human being, and all classes of small circulatory vessels can usually be visualized in the microscope with good clarity. That's why they're using the hamster blood vessels. Now, these are the things I want you to focus on. Studies were performed on 18 male hamsters. The effects of topical application, putting butcher's broom on their actual cheek cells at different concentrations of butcher broom on arteries and veins, internal diameter depended on the temperature in which the hamster's cheek pouch preparation was observed. They actually found if you did something at 36 degrees Celsius and 40 degrees Celsius, they saw a change in how those arteries responded to the butcher's broom, which I found interesting. At 36 degrees Celsius, 36.5, arteries tended to dilate. They opened up, just like we saw with the other studies, with butcher's broom extract, or remained unchanged when higher amounts of butcher broom was given, and they found while the veins were constricting. Let me read that again because that sounded kind of confusing. At 36.5 degrees Celsius, arteries tended to dilate with concentrations of butcher's broom at less than 50 micrograms, or to remain unchanged when higher concentrations of butcher broom were applied, while the veins constricted, just like we confirmed before. Sorry, I read that a little bit odd. When they increased the degrees by 3.5 degrees, arteries either remained unchanged for the concentrations below 10 micrograms with butcher broom's extract, or constricted when higher concentrations of that extract were applied, while veins exhibited further constriction. So as they raised the temperature, veins even went down even further. This actually supports my red light sauna space, relax sauna. The saunas I recommend, you apply heat to the body. It improves even your blood vessels and absorption of herbs. Now, in case all of y'all were wondering, well, how hot is 36.5 degrees Celsius? I put it on here for you. 36.5 degrees Celsius is 97.7 degrees Fahrenheit, which is right around where your body temperature should be. So butcher's broom at this degree of the human body will actually open up arteries and constrict veins. Well, how about all you with varicose veins? Would you like to shrink those back down? That's what butcher's broom does. If you've got spider veins, would you like to shrink that back down? Good. If you've got blood pooling in your legs, changing the colors of your veins and swelling of your feet, you need to be on butcher's broom. In our study, systemic administration of butcher's broom, giving it to the whole body, orally or in a vein, like injecting it. It says that evoked vein constriction and did not change the average artery diameter. So overall, they found butcher's broom, once again, shrinks the veins of these animals, like in humans, but they didn't find too much of a change with the artery changes overall. But they did find it with the 97.7 degrees Fahrenheit. Topical applications of butcher broom extract caused concentration and temperature-dependent responses in these studies with these blood vessels. The contractions caused by the extract are augmented or changed by local warming and reduced by cooling. Isn't that amazing? Rudofsky, this is a researcher, reported a decrease of about 10% in the veins capacity 2 hours after swallowing butcher's broom extract. Within 2 hours, they saw less blood in the veins because the veins constricted by 10% volume. So when the tube shrunk, the amount of blood in there shrunk too. That means you're getting better blood flow back up to the heart. In 2 hours. That's amazing. Our results, they say, showed that butcher's broom extract given orally evokes vein constriction. So they just figured it out also. Topical application of the extract elicited concentration and temperature-dependent effects on arterial and vein diameters. So what they were just disclosing is when you swallow the stuff, it causes vein constriction. When you swallow butcher's broom, which it is in our supplement too, if you're going to swallow it, we see improvements regardless of temperature, whatever. They just saw changes when they put it on topically. You had at different degrees, 36.5 Celsius and 40 degrees Celsius. They saw a change in the arteries reactions, but not the veins. Butcher's broom as a potential treatment for orthostatic hypotension. Oh my God, I hope you're listening to me. How many of you stand up and get dizzy, get vertigo? That's orthostatic hypotension. Butcher's broom as a potential treatment for that. Chronic orthostatic hypotension is frequently a severely debilitating disease that affects large groups of the population who have autonomic nervous system insufficiency. And these are those groups: chronic orthostatic hypotension, low blood pressure. It's the elderly, patients with diabetes, those with Parkinson's disease and chronic fatigue syndrome, and anyone on drugs that affect the autonomic nervous system. You want me to name one? Prednisone. You want me to name another? Hydrocortisone. Those affected. Did you know that those are the groups of people that are most affected with chronic orthostatic hypotension? Now, I want y'all to pay attention to this because many of you know and have loved ones, or you yourself are on drugs for orthostatic hypotension. Unfortunately, they state, even though more than 60 drugs, prescription medications, are currently being used to treat orthostatic hypotension, none of them is particularly or consistently effective. Did your cardiologist tell you that when they prescribed your hypotension drug? Did they tell you there's 60 of them on the market approved by the FDA, but none of them are consistently or particularly effective at reversing that? Well, butcher's broom, a phyto or plant therapeutic agent that is well known in Europe, may, however, change this. It's vasoconstrictive. It's blood vessel constricting and vein tonifying, making them stronger muscular-wise. Properties make it ideally suited to treat the pooling of blood in the limbs, lack of venous tone, vein tone, and lack of neurally mediated vasoconstriction that frequently characterize orthostatic hypotension. And read this next statement. Ready? Although it has never been suggested as a treatment for orthostatic hypotension in America, it already has a long proven record of use in Europe for treating a variety of circulatory disorders. The results in this study they found: butcher's broom, a plant therapeutic agent containing these substances, ruscogenins and flavonoids, may prove useful for the treatment of orthostatic hypotension. In turn, it stimulates the release of noradrenaline at the level of the vascular wall. Butcher's broom also possesses vein tonifying properties, making the muscles of those veins stronger. It reduces vein capacity. It reduces the blood that's sitting inside those blood vessels. And pooling of blood, it reduces the pooling of blood in the legs and exerts protective effects on the capillaries and the vascular endothelium, the inside of your blood vessels, to protect you from plaque and other things, and smooth muscle. Unlike most of the drug therapies used to treat orthostatic hypotension, Butcher's Broom does not cause laying down, looking up hypertension. It also appears to do something no other drug or therapy can offer. Butcher's Broom alleviates the worsening effects of orthostatic hypotension in environmentally hot conditions. Your symptoms get worse the hotter you get, but Butcher's Broom, you never even see that. It never even happens when you're on Butcher's Broom. Finally, Butcher's Broom is an extremely safe, inexpensive, over-the-counter botanical medicine. Isn't that amazing? I mean, how many times do you read that the drugs for this condition have zero effect and have never worked, and there's 60 of them that the FDA has approved? I mean, why is anybody even trying them if they don't even work? All right. This is the next study and theme, a medical journal online, a journal titled Planta Medica, Medical Plants. It's titled Butcher's Broom, a rich source of bioactive steroidal saponins. Steroid meaning reducing inflammation. You know what steroids do, right? Like prednisone, reduces inflammation. This is the drug activity, how the medicine in the plant functions. From the pharmacological point of view, the most studied Butcher's Broom species is undoubtedly Ruscus aculeatus, a very ancient phlebotherapeutic agent. Phlebo, you ever seen a phlebotomist? Phlebo means blood person. Phlebo, blood therapeutic agent. Since the discovery of the vein constricting and vein tonifying properties of ruscogenin and neuroruscogenin inside of Butcher's Broom, and the particular Butcher's Broom called Ruscus aculeatus was extensively used, especially in Germany and France, for the treatment of chronic venous insufficiency, also for varicose veins, hemorrhoids, and orthostatic hypotension. You know, as I go through some of these research studies, sometimes I think, man, wouldn't it be better off to not be in America being treated by MDs? At least the MDs in other countries are open to all natural therapies that actually work. They've been using this stuff for decades. In fact, in 1972, inside of Butcher's Broom extract is something called sapogenins. Sapogenins, isolated from Butcher's Broom, also display anti-inflammatory activity in these rat studies they found. When they had rat paw edema from venous insufficiency, it's no different than a human's feet swelling. Their paws swell whenever they have venous insufficiency. Well, they saw that Butcher's Broom, as far as 50 years ago, was reversing this in mammals. This researcher named Rudofsky, we referenced him earlier, he reported a decrease of about 10% in vein capacity of blood 2 hours after swallowing Butcher's Broom in a supplement. Patients with chronic venous vein insufficiency treated with Butcher's Broom extract maintained constant vein tone, normal size of the vein, and had improved vein emptying, unlike those who didn't receive it. Other studies deal with the antimicrobial activity against 8 different bacteria and 5 different types of fungus strains, and Butcher's Broom has antioxidant activity also, as well as some compounds previously isolated from them: turmeric, caffeic acids, and rutin. By the way, rutin is also inside of our CardioFlow product. Butcher's Broom has been investigated in doses of 125 milligrams for every 2.2 pounds, 250 milligrams per every 2.2 pounds, and 500 milligrams for every 2.2 pounds using 2 rat models of acute inflammation. Remember, if it happens in a rat, it's going to happen inside of you. The results of the experiment showed a dose-dependent anti-inflammatory effect. The more Butcher's Broom they gave them, the less inflammation they had. Isn't that amazing? This steroidal type compound in Butcher's Broom called ruscogenin has been found to exert significant, not a little bit, a lot of anti-inflammatory and anti-blood clotting activities. Anybody concerned about blood clotting? Anybody have an elevated D-dimer test come back? You better get on Butcher's Broom, and on our CardioFlow product, I'd recommend. Butcher's Broom represents the best known and appreciated Ruscus species of plants. Listen to how long they've known about butcher's broom's effects on the blood. Since the Middle Ages, the young shoots of butcher's broom were used as medicinal agents for disorders involving the vein system, anticipating the proven success of its hydroalcoholic extract in Europe. That's just how they did it. They extracted the components out of the plant using alcohol. The scientific production focused mostly on Ruscus aculatus, which is in our cardio flow, butcher's broom. A biological evaluation of butcher broom's extracts were mainly focused on investigating and exploring deeper its use for venous diseases. Since the Middle Ages, that's what they've been focusing on this plant for because it's so powerful. Due to its benefits demonstrated in several clinical studies, oral supplementation with butcher's broom is recommended. How about that? The anti-inflammatory effect could be superior to the reference drug called diclofenac. Can you believe that? According to the dose and the moment of determination. Okay, I have to focus on this one. Any of you out there on any NSAIDs, non-steroidal anti-inflammatory drugs? NSAIDs, Aleve, Advil, Tylenol, aspirin, you name it. Did you know, read this sentence again, the anti-inflammatory effect of butcher's broom could be superior to the reference drug called diclofenac. Well, what is diclofenac? It has these different brand names: Cambia, Zipsor, Zorvalex, Cataflam, Voltaren, Voltaren XR, and Dilaject. Those are drugs right now being prescribed all over America for people in pain. Diclofenac is a NSAID, a non-steroidal anti-inflammatory drug. It is used to treat mild to moderate pain or signs and symptoms of osteoarthritis or rheumatoid arthritis. Voltaren, another brand name of this drug, is also indicated for the treatment of ankylosing spondylitis, a very terrible spinal condition. The Cataflam brand of this medicine is also used to treat menstrual cramps. Also, diclofenac powder is used to treat migraine headache attacks. I want to remind you all, the research shows the anti-inflammatory effect of butcher's broom could be superior to the reference drug called diclofenac. I didn't make it up, but if your medical doctor has prescribed you any of these diclofenac drugs, here's their names again. Look at the screen. If you've been prescribed those for inflammation and pain, butcher's broom is better, superior to the pain relief. Isn't that amazing? Plants are better than drugs, baby. I love it. All right, now also in Theme Magazine, online medical journal, they studied the efficacy and safety of butcher's broom preparations in patients suffering from chronic venous insufficiency. I've shown you a few animal studies. It's time to show you some human studies. Extracts from butcher's broom rhizome have been widely used in the oral treatment of lower leg edema in patients with chronic venous insufficiency. In this study, 166 women suffering from chronic venous insufficiency, remember the pictures I showed you a little bit ago, 166 women with this issue. They took 148 of those 166 people. They had an average disease duration of the vein issue. Remember the pictures. They had to have those conditions an average of 14.6 years in the butcher's broom group. And in the placebo group, the average was 15 years they had the problem. They were eligible for this research study. The primary parameter was the area under the baseline of the leg volume changes over 12 weeks. They want to know what's the size, what's the weight of the amount of water and edema in the legs of these individuals, these women, after 12 weeks, 3 months only. Remember, they had these diseases for 14.6 years for the treatment group with butcher's broom, and those who didn't get it, 15 years on average. Let's read what they discovered after 12 weeks of giving them butcher's broom. 3 months only. Cardio flow. 3 months only. Here we go. There were significant differences between the treatment groups with butcher's broom and the placebo group. The change of leg volume after 8 and 12 weeks of treatment, for changes in the ankle and the leg circumference after 8 and 12 weeks of treatment, and for the changes in subjective symptoms, the patient telling you how they felt. Heavy, tired legs and sensation of tension were all reported to be better only in the butcher's broom group. For the changes in the symptoms, heavy lower legs, sensation of tension, think about your loved ones who have these conditions. For the changes in the symptoms in 12 weeks of heavier lower legs, sensation of tension and tingling sensation, A significant positive effect with the changes in leg volume was shown. Overall assessment of the efficacy of Butcher's Broom was significantly better for Butcher's Broom. Considering the study duration of only 3 months, it is concluded that Butcher's Broom, in the recommended daily dosage according to the German monograph, is a safe and effective treatment for patients suffering from chronic venous insufficiency. You heard it here first on the Dr. Ardis Show, people. This is Cardio Flow. I want you to know Butcher's Broom is in this product, and I had to put it in there several years ago when we created it. You see it highlighted right there on the screen. Butcher's Broom extract called rhizome at 100 milligrams. That's what's in this per serving. Butcher's Broom is just one incredible of the 13 or so ingredients in there in Cardio Flow that I put in there specifically to address almost every scenario you can think of related to cardiovascular health. I hope that Cardio Flow blesses your life. I just want you to know it was out of stock for a long time because I'm very picky about the ingredients. It is now in stock. Go get yours today. Cardio Flow, Butcher's Broom. You've seen it for yourself. It works in animals. It works in humans. It's amazing. It's been used in countries for decades by medical doctors. All right. Scan the code here again for free access to get on our newsletter. We actually have a monthly newsletter now if you want to get notified of when that's ready. And we have our weekly podcast. If you want to be notified when it's ready for the general audiences, go there. If you're not an Ardis Club Experience member, go sign up at the Dr. Ardis Show if you'd like. And please don't forget our book, Moving Beyond COVID-19 Lies. I actually dive into other ingredients, other plants inside of Cardio Flow. I highlight it as a part of multiple solutions to individuals having many, many cardiovascular problems since COVID-19 was unleashed on the world. Long COVID represents many of the symptoms that are actually compiled as a list of what are called long COVID side effects. And just a week before I produced this interview about Butcher's Broom, the Cleveland Clinic just published a week ago from the time of this recording that they expect COVID-19 sufferers who ever got COVID-19 at all will have heart problems. 25% of them, a quarter of all of them who got COVID, will have heart problems for the next 3 years. From today. You don't have to suffer for the next 3 years. There are solutions. You can find them in our book at COVID-19 Lies, Restoring Health and Hope for Humanity at the Dr. Ardis Show, and then also Cardio Flow, don't forget it. This is my effort to educate you on some of the most miraculous things found in nature that even outperform or much safer and don't have those toxic side effects as the other drugs being prescribed for heart issues around the world, and particularly in America. No country prescribes more drugs than America. This is why I'm so excited to present to you those things found in nature that science has actually confirmed outperform the inflammation and the blood flow issues that people have in the millions in America. May Cardio Flow and Butcher's Broom be a lifesaver and a life improver for you. Look forward to hearing from you. Please share with us if you're using these products and you're seeing benefits in your lives or the loved ones around you. As you watch their swelling go down in their legs, their varicose veins and spider veins disappear. I hope you'll tell us about those miraculous stories. Take pictures, send them to us. We'd love to see it. We want to celebrate with you the wins. And then we'll celebrate with you, maybe even have you come on and join us on the podcast to talk about your amazing experience 12 weeks after you started Cardio Flow. God bless you all. Have a great day. We'll see you next week. I'm Dr. Ardis.